Ever feel like your health information is just everywhere and nowhere at the same time?
Oh, absolutely.
Like trying to piece together everything you've told different doctors over the years? It seems odd, doesn't it, in this digital age?
It really does. For something so personal, it's often surprisingly scattered. And that's kind of where electronic health records, EHRs, are meant to step in.
Okay, EHRs.
Yeah, think about those old doctor's offices, the walls of paper charts.
Right, the filing cabinets.
Exactly.
Yeah.
An EHR is basically the digital version of all of that.
Yeah.
Your medical history, test results, allergies, meds, all stored electronically. Securely, hopefully.
So it's more than just scanning the old paper stuff. It's like a different way of managing health info altogether.
Precisely. It's designed to, well, streamline things and give a much fuller picture of your health quickly. Our goal here really is to give you a clear introduction.
A deep dive, as it were.
A deep dive, yes, into what these digital records are, what they promise, but also some of the complexities. We're pulling from different places basic info like Wikipedia, but also specifics on standards like FHIR, privacy stuff like HEMPA, India's ABHA initiative, and even how AI is getting involved, based on a pretty interesting healthcare AI book.
Okay, let's start with something basic. Just getting your own information. It seems like that should be simple, right? But who hasn't chased down test results or forgotten a medication name?
Right. It's a common frustration. EHRs, ideally, put that information more directly in your hand.
So you can just log in and see your history, your lab results.
That's the idea. See your history, view results, often quite quickly after they're done. It helps you be more informed, more in control. And, in some places, it's not just a nice to have. It's actually a legal right for patients to access their records electronically.
That makes a lot of sense. If you can actually see what's going on, you can be a better partner in your own healthcare. I think I saw something about this actually improving outcomes too, like for diabetes.
That's right. There's research suggesting that when people with type 2 diabetes can access their EHRs, it correlates with better blood sugar control.
Really?
Yeah, it seems empowering them with their own data helps them manage their condition more effectively day to day, understanding trends, tracking progress, that kind of thing.
Okay, that's a clear benefit. Now, what about the big promise we always heard that EHRs would save tons of money and make healthcare super efficient? I feel like I've heard mixed things on whether that actually panned out.
Ah, yes. The cost question. That's definitely still a hot topic. It's interesting because some major researchers, places like Harvard, Wharton, Stanford, have actually questioned how much cost savings EHRs have really delivered across the board.
So why is that? Why wouldn't they save money?
Well, one argument is the huge upfront cost. Implementing these systems is incredibly expensive. Plus training staff, ongoing maintenance, it all adds up. These initial and recurring costs might eat into or even outweigh the savings, at least initially.
That makes sense. Those big IT projects are never cheap. But then you hear stories like that NHS Trust CEO in the UK, didn't he call a 450 million EHR system chicken feed?
He did, yeah.
Yeah.
Which sounds wild, right?
Totally.
But his point was, in the grand scheme of the overall NHS budget, and crucially, because that one system replaced over 100 separate older IT systems.
100? Wow.
Exactly. So from that perspective, consolidating all of that complexity into one platform, that does offer massive potential for long-term efficiency gains, reducing administrative tangle, maybe lowering overall IT running costs eventually. It just shows the calculation isn't simple. It really depends on the situation.
Okay, so patient access is a plus. Cost and efficiency are debatable or context dependent, maybe.
Something like that, yeah.
Let's get into the really sensitive part then. Privacy and security. Putting all this incredibly personal health data in one digital place, it makes people nervous, and probably for good reason.
Absolutely. It's a huge concern. And you saw that reflected in the pushback against national centralized health databases in places like the US, the UK, Germany. People worry about breaches, misuse.
Understandably so. So what's being done to protect this information in EHRs? What are the safeguards?
Well, in Europe, you have the GDPR, the General Data Protection Regulation. That sets a pretty high standard for protecting all personal data, including health data. It dictates how it can be collected, used, stored.
Okay, so strong regulations are one piece.
Definitely. And technology is playing a role, too. That AI book we mentioned talks about AI-driven smart data de-identification tools.
De-identification, so stripping out the personal bits.
Exactly. These tools can automatically remove or obscure information that could identify a patient name, address, that kind of thing, when the data needs to be shared for research. It's a way to try and get the value out of the data for improving medicine without compromising individual privacy. A tricky balance, but important.
Those tools sound clever. Okay, another challenge. If my doctor uses one EHR system and the hospital uses a different one, how do they talk to each other? It seems pointless if the information is stuck in silos.
You've hit on a key term there, silos. Breaking those down is all about interoperability.
Interoperability, making things work together.
Precisely. Making sure different systems can securely exchange health information. And a major effort in this area is a set of standards called FHIR, Fast Healthcare Interoperability Resources.
FHIR. Okay.
Think of it like a universal translator for health data. It provides a common language and structure so different EHR systems can understand each other's information.
So it's like getting all the different health software to speak the same dialect.
That's a great way to put it.
Yeah.
And FHIR isn't just theory, it's being actively developed and implemented. It's gone through several versions. Countries are adopting it. Israel, for example, has developed something called Israel Core based on FHIR. And you have organizations like HL7 heavily involved in pushing these kinds of health informatics standards forward.
Okay, standards are key. Now, let's talk about AI. This feels like where things get really futuristic. How is artificial intelligence starting to work with all this data locked up in EHRs?
Yeah, this is where it gets really exciting. That AI book describes AI potentially acting as wrappers around the existing EHR data.
Wrappers. What does that mean?
So imagine the EHR is this huge, complex database, right? Maybe built on older technology sometimes. The AI wrapper is like a smart layer of software that sits on top. It doesn't necessarily replace the EHR, but it allows us to interact with the data in the EHR in new ways, analyze it, make sense of it, use it more effectively.
Okay, like an intelligent interface almost. Can you give some examples? What would these wrappers actually do?
Sure. The book gives some great examples using large language models, LLMs. Think about getting a new prescription. It can be confusing.
Definitely, all the jargon.
Right. So an AI wrapper could potentially look at the prescription text or even an image of it, pull out the key details, and then generate a simple plain language explanation for the patient. What it's for, how to take it, side effects.
Oh, that would be amazing.
Wouldn't it? Or think about doctors writing notes. It takes up so much time. AI wrappers could potentially summarize long patient histories or consultation notes, highlighting the key points for the clinician.
Freeing them up to actually talk to the patient more.
Exactly. It acts like an intelligent assistant, really helping to unlock the value that's already sitting there in the EHR data.
Those are really practical examples. What else? How else can AI and EHRs work together?
Well, beyond just understanding, it's about safety too. Medication reconciliation is a big one. AI can analyze a patient's full medication list from the EHR, cross-reference it for potential dangerous interactions, flag allergies the doctor might have missed, or even spot potential dosage errors.
Wow, like a safety net.
A really important one. Reducing medication errors is a huge goal in healthcare.
I bet. The book also mentioned AI in outpatient departments, OPDs. How does it help there?
Yeah. In the outpatient setting, AI using EHR data can streamline things quite a bit. You could have, say, smart appointment scheduling, optimizing the calendar based on patient needs, doctor availability, maybe even predicting no-shows.
Predicting no-shows, okay.
Or automated patient triage. Based on symptoms entered, maybe combined with their history from the EHR, AI could help guide patients to the right level of care more quickly.
So optimizing the flow from the moment you try to get an appointment. What about behind the scenes, more technical stuff?
Oh, yeah. The book talks about something called rapid application integration and development. Here, AI uses EHR data to help, for instance, automatically digitize clinical protocols that might still be on paper or in old formats.
Turning guidelines into active tool.
Kind of, yeah. And helping build clinical decision support systems faster, getting evidence-based recommendations to doctors at the point of care more quickly.
That sounds powerful. And what about just running the hospital itself, the logistics?
Big area there, too. Hospital resource management. AI analyzing EHR data can help optimize operating room schedules, predict peaks and troughs in patient demand to help with staffing levels.
So fewer canceled surgeries, maybe? Making sure enough nurses are on shift?
That's the aim. Even financial optimization. Things like real-time claim scrubbing, using AI to check insurance claims for errors before they get submitted and potentially denied.
Yeah.
That saves a lot of hassle and improves revenue.
Okay, so it helps patients, doctors, and the hospital management. It seems to touch everything.
It really has the potential to. Think about discharge planning. AI can analyze EHR data to spot patients at higher risk of being readmitted soon after leaving the hospital, maybe because of social factors documented in their record.
So you can give them extra support before they go home.
Exactly. Targeted interventions. And clinical trials, too, using EHR data to find eligible patients faster, which is often a major bottleneck in developing new treatments.
It's incredible how many angles there are. You mentioned inpatient wards, too, and emergency rooms.
Yes. On the wards, AI might analyze EHR data to flag patients at risk for things like pressure ulcers, so preventative steps can be taken, or power early warning systems for clinical deterioration, picking up subtle signs that a patient might be getting sicker.
Catching problems earlier.
Right. And in the ER, integrating AI with EHR data can help with faster, more accurate initial triage and assessment when time is absolutely critical. Plus, don't forget radiology and pathology, AI analyzing medical images, which are often stored and linked within the EHR.
Assisting with diagnosis.
Assisting, yes. Or even in the ICU, predicting readmission risk, helping guide sedation levels based on real-time data from the EHR and monitors.
It's really weaving itself into the fabric of care. What about really complex areas like genomics?
Another huge potential area. Analyzing complex genomic data, possibly linked within the EHR, to help diagnose rare diseases much faster, or identify genetic markers for personalized treatments.
Personalized medicine.
Exactly. And that leads to the idea of AI-powered treatment plans tailored to the individual, potentially integrated right back into the EHR, maybe using those FHIR standards for smooth integration.
This is all moving so fast. Now, you mentioned ABHA earlier. Remind us how that fits in specifically in India.
Right. ABA-Age, the Ayushman Bharat Health Account, it's a major initiative in India, part of building their national digital health ecosystem. It's still evolving, but the idea is for it to be a core component, linking different health schemes and records together digitally. It's basically India's big push towards connected digital health records.
Got it. Another piece of the global puzzle. Now, we can't really wrap this up without talking more about HIPAA, especially for our U.S. listeners. What's the main takeaway regarding HIPAA and EHRs?
HIPAA, the Health Insurance Portability and Accountability Act, is foundational in the U.S. for EHRs. Its core job is to set the rules for protecting the privacy and security of your identifiable health information. That's crucial for trust.
Privacy and security rules.
Yes, and it also has administrative simplification rules. Those are meant to make the healthcare system more efficient by standardizing electronic transactions, like billing.
But I've heard HIPAA can be complicated, sometimes maybe too strict.
That's a criticism you hear. Because the rules are complex and the penalties for violations can be severe, some argue it makes providers overly cautious about sharing information, even when it might be needed for good patient care. It's a balancing act for sure.
Between privacy and efficient care.
Exactly. And it's worth noting, HIPAA isn't just about privacy. Title I also has patient protections related to health insurance, like making hidden exclusion periods invalid.
Okay. And finally, what about just the overall governance, the legal side of things?
As EHRs become more central and complex, especially with AI integration, the governance and legal frameworks are critical. You need clear rules about data ownership, access rights, liability if something goes wrong with the system or the data. And ensuring compliance with national laws, like the Information Technology Act in India that the AI book mentioned, is essential. These frameworks have to keep evolving alongside the technology.
So, bringing this all together, EHRs are clearly way more than just digital paper. They're kind of the backbone for a lot of modern healthcare. Huge potential for patient access, maybe some efficiency gains eventually, but definitely big questions around cost, privacy, security.
Absolutely. And increasingly, they're the platform upon which these powerful AI tools are being built, which opens up a whole new set of possibilities and challenges.
It really feels like a fundamental shift towards a more connected, data-heavy, maybe more intelligent healthcare system.
That's a good way to summarize it, yeah. A foundational shift.
Okay, so as we finish this deep dive on EHRs, here's something for you, our listeners, to think about. What do you reckon is the biggest single barrier to really getting the most out of these digital health records? Is it the technology itself? Does it need to get better, easier to use? Is it the policies and rules? Do we need clearer laws, better standards? Or maybe it's us, the human factor, how doctors, nurses, and patients actually adapt to and use these systems. Finding that sweet spot between easy access, rock-solid privacy, and driving innovation. That seems like the core challenge ahead.